This is a special nursing week for ONA. This is our 40th anniversary, 40 years of celebrating in representing high quality nursing staff and allied health professionals all across Ontario. So 40 years, and it's a great anniversary year for us. We chose the Value the Invaluable theme because we wanted to not only send a message to the public or to our employers, to our patients obviously, but for us as the nurses of Ontario to be able to look at that and say, you know what, I am valuable, and I know that my patients value me. I know that my employer values the work that I provide. I know that the public respects me as a nurse. Value the Invaluable was a really simple way of us really saying we as the nurses of Ontario are valued. We are a strong union, we're a powerful union, and we're 60,000 voices all across Ontario. We have 14,000 nursing students as our affiliate members. We are 74,000 voices to ensure that the healthcare system is taken care of and that the nurses of Ontario are taken care of. The nurses in Ontario and our allied health professionals have a number of challenges that we're facing. At this point in time, we've got the squeezing of budgets in all facets of healthcare, and unfortunately, we as the nurses are getting the brunt of that. Whether it's not enough staff to be able to provide that quality care, replacement of staff, our working conditions are very, very concerning. And that's in every sector that we represent. When we look at specifically the different sectors, we can talk about the hospitals, we can talk about the wait times for our patients, we can talk about the fact that we have hallway nursing. Still to this day, we have hallway nursing. In our long-term care facilities, we do not have enough nursing staff, and we continue to advocate for our elderly. In our public health units, our programs require that we actually have the appropriate nursing staff and the appropriate funding to ensure that those programs continue. And in our communities, we have our community care access case managers that are each and every day trying to move that care from the hospitals into the community with limited resources. I can tell you that the nurses feel very comfortable in now speaking out on behalf of the public, speaking out on behalf of healthcare, advocating for those kind of quality work environments so that we can have a quality work environment and then we can provide that quality care. The next 40 years, well, I know that the students that are coming out today are very vocal. They are advocates. I think there's going to be lots of changes. We're so used to change in the healthcare system, and as nurses, we can go with the flow. We just need to ensure that we are part of the solution and that the solutions that we have are listened to, and that we are in those boardrooms and in those powerful situations where those decisions are being made so that we actually can have a positive impact on healthcare in Ontario. I think ONA is a lifeline. ONA is a lifeline that each and every one of our members across Ontario know that we are at the end of the phone, we're at the end of a voicemail, we're on the units and in the areas that they're working, and they know that if they have an issue that they can come to us at any given time. They know that we're there for them, that not only are we negotiating a collective agreement that hopefully values and respects the work that nurses do each and every day, but we're there to ensure that we can have a safe work environment. Occupational health and safety, as an example. SARS wasn't too long ago, it was only 10 years ago. Human rights and equity issues, discrimination and bullying and harassment in the workplace. And if we can work in a quality work environment, that's going to help us provide the quality of care that we so desperately want to provide each and every day. So that's why I got involved in ONA, and I'm hoping that many of the members out there that may not have in the past thought about getting involved in ONA, who have the same kind of values that I've just mentioned, want to come forward and join ONA and be part of our leadership group.